Hi, my name is Amulya,
And I'm Archisman.
and we are MBBS students at AIIMS New Delhi. And in this video, we want to cover what are the factors that you should consider in a college for, like, if you're looking for a college to do your MBBS in India, and if you have USMLE or going abroad in your mind. So, what should be the factors that you should consider while selecting such a college? And like Archishman, we have seen that usually students in India select college on the basis of the ranking of the college and what is the quote unquote prestige of the college, and uh, uh, like these are the things that usually determine how people select the college. But I think this needs to change because ultimately it depends upon your goal. And once you become an MBBS doctor, I don't think anyone actually asks you कि तुमने किस college से पढ़ाई करी.
Yeah, exactly. So, as Amulya pointed out, it doesn't really matter once you complete your degree where you have passed out from. However, having said that, there are some points that should be considered if you have USMLE in mind, and I think after this session you will have a better grasp of what all to consider.
Yep. So I think the first point that we should think about is freedom in general at a college. For example, like there are certain colleges where you do not have that much academic freedom. They would keep you busy in your exams and your semesters and your classes and everything, that like it becomes very difficult for you to get time to do anything else. And unlike NEET PG or INI set where you have a linear preparation, that is like if you put more hours of study you'll get more reward. USMLE is not like that. USMLE has a lot of divergent thinking, so to say,
One
happening there.
analogy that I often use when I speak to other aspirants is that USMLE is more of a marathon where you have to keep in mind a number of things longitudinally over the course of your MBBS. Whereas PG preparation, I would say, is more like a sprint because I have seen people there who the most intense phase is the last 6 months or so. So what you do in those last 6 months before the exam is ultimately determines what rank you get. USMLE is in like that, and since there is no proper ranking system as such, they select you on the basis of your comprehensive CV and everything. So it takes much more time and effort to build your CV from bottom up.
Yep, and this is a system that is not present in India as such when we come to higher education, and that's why it becomes very difficult for us to adapt to it. So, if your college has a lot of freedom, then you would get time to do research, you would get time to attend electives, you would get time to go to conferences, and all this adds up ultimately to your final match in residency. So, I think freedom is the most important thing. So, for example, I
So
went
when
to.
we're talking of freedom, we basically mean like if a college has fortnightly exams and you have to study for those exams, then you wouldn't be able to focus on something else. At the same time, like if during postings, your postings are very hectic, or they in all the postings you have to attend the postings rigorously and you can't really miss any of them, then if you want to prepare for the steps during that time or something like that, you can't do that. Also, another important component of freedom is the workload during internship, because internship is a period when your step 2 would be near. If people haven't done with step 1, then they would also give step 1 during that period, and then you have to build your CV parallelly because your last years are near, and then you have to do the CE. So if your internship in the college you take is very hectic, then it becomes difficult to juggle all these things together.
Yep, and so if you just have given need and you are selecting a college, if it's your second round of counseling, then I think it would be better for you to talk to students who are already enrolled in that college. So you can ask them, compared to your peers in other college, what is the stress level at your college? So these would be the questions that you should be asking. Ki, how much time do you have to spend in classes, or how hectic are the classes? Like in some colleges there are a lot of assignments. For example, I've talked to a few people in LHMC and they always have a lot of workload on them, and the professors are always on their head to do that work. So it becomes difficult for them to think out of it and think about research. Like I've seen a lot of brilliant researchers from LHMC also, but still it becomes an uphill task. It's not a downhill task. And again, in colleges like JIPMER, where the academic pressure is too high, these people perform really well on their step exams, but it becomes an uphill task again for them to build their CV. And that's important. CV is very important when it comes to applying to any place abroad, not
like
just
we can
US.
speak for AIIMS. Like AIIMS gives us immense freedom. Like the internship isn't that hectic. We can choose to not go to some postings, although that's not official. And in third year we don't really have any exams, so we are free to prepare for our steps and all.
Yeah, and so that is the first point, freedom. The second point that you should be considering is VSLOs. So I
What
hope.
VSLO stands for is Visiting Student Learning Opportunity. It is also sometimes called the VSAS, which is Visiting Student Application System. So it is basically a system that was developed by the American Association of Medical Colleges, AAMC, in which they streamlined the whole process of application for CEs. They asked
So
the
wait. We are making this video for, I think, potential first year students. So they might not be knowing about CEs. So CEs stand for clinical electives. So clinical electives are basically hands-on clinical experience that you get in the United States of America. So for example, if you are, I'm currently studying at AIIMS New Delhi. If I get a CE at, let's say, Cleveland Clinic in United States, I would be going to Cleveland Clinic, and I would be working. I would be like studying there as a student for 1 month. Uh, I would basically be attending a clinical posting, and the professors over there would be judging me. They would be seeing me,
like
evaluating
I would
me.
be acting as if I am a medical student there.
Yep. So, and that is very essential when it comes to building a CV for USMLE and applying for your residency, because these are the places where you go there and you come to know about the professors over there. You come to know about you make friends with other people there, and you also get acquainted with the system. So, for example, if I go to Cleveland or any other clinic in the United States and I get acquainted with the program director over there, I talk to the professors over there, then that would increase my chances of matching at that place if I'm able to impress that person. And CEs are very, very important. Like, I think it would not be wrong to say
it is one of the most
that that it's getting more important than your USMLE step 1 and step 2, because these are exams you'll have to inevitably clear. But if you're able to impress a program director in a CE, then you are definitely getting that
So
spot.
apart from the networking bit that Amulya covered, also what comes out of US clinical experiences or USCs are LORs, which are letter of recommendations. So a letter of recommendation from a US physician is much more valuable for the USMLE match process than one from an Indian professor.
Yep. And
So
so for applying for the CE, you require VSLO. It's not compulsory,
it's
but
not compulsory. So you basically for matching at most places, they have a minimum requirement of 2 months of USC, and USC is something that you can only do when you are doing your MBBS and not after that. Like once your MBBS ends, it becomes observerships. Some programs consider observerships to be USCs where others don't, so it's bit of a gray area. But just to be safe, if you can, you should always do a hands-on clinical elective during your MBBS. And and as I said, the minimum requirement is 2 months for most places.
Yep. And like Archisman said, observerships. Observerships are basically clinical experiences where you won't be allowed to interact with the patients. You won't be allowed to see the medical records of the patient. You would be just allowed to stand there, and you won't be
You will
participating.
be observing other physicians taking care of patients.
Yep, exactly. So observerships do not hold that much value as compared to a clinical elective, where you would be interacting with the patients, where you would be taking histories and doing examinations. So that is like the proper clinical exposure that you are getting through CE. And CE, and to apply to CE, either you can directly apply to the college, but those options are getting limited by the day. And these days a system called as VSLO is designed for you to apply to CE. Okay, but the problem with VSLO is that like anyone cannot make an account on VSLO. For example, I, an AIIMS Delhi student, cannot make an account on VSLO right now because my institution, that is AIIMS Delhi, is not affiliated with VSLO as a home institution, right? So your college has to be affiliated with with VSLO as a home institution. Then only you would be able to apply for a clinical elective. And very few colleges in India are affiliated with VSLO. These include KMC, GMC Chandigarh, and Danan Medical College. Then I think JSS Medical College, and BJMC Ahmedabad. So these are few medical colleges which are affiliated to VSLO, and these students find it very easy to apply to a lot of institutions in USA. For example, Mayo Clinic is one of the primary institutions which has a lot of residency spots for IMGs, and it also has a good reputation, and it accepts a lot of clinical electives. But now it accepts application only through VSLO. So like other people like us from AIIMS cannot apply to Mayo, but these people who are studying in the colleges which are affiliated to VSLO, they can apply to Mayo Clinic, right? So
and gradually more and more institutions are getting affiliated to VSLO because it helps them from a monetary standpoint, because it saves them money for processing applications and everything. So over the years we can expect that more and more institutions would get affiliated, and then Indian institutions which aren't affiliated as home institutions would be at a disadvantage.
Yep. So I'll put a link in the description of all the institutions which are actually there in VSLO right now. You can check that out, and you can see if the college you are expecting is there or not. Okay. So VSLO is one thing. Then what else should we consider while we are preparing for USMLE?
Apart from VS, I think the research part, like if your college or the one that you are thinking of choosing, if it has professors who are prolific publishers and who do good quality research and they encourage students to participate in their research projects, I think that helps a lot. Like in AIIMS, we have professors who are very willing to let students participate in their projects, and then if we take our own projects to them, then they are willing to help out in their labs and all. So having an institute that has a very conducive research environment, that helps, because research is a very big part of the USMLE application process. Like it has been shown that people who have more publications, more research, that it's not like a very hard line criteria, but they say that they are preferred often than a person with similar credentials but without research.
Yep, and like other colleges of other branches of AIIMS, for example, AIIMS Rishikesh has a good research culture because these colleges are seeded by professors who are usually from AIIMS Delhi only. And there might be some colleges which have absolutely no research culture, where the professors discourage research. So this is something you can ask from students who are already studying in your dream college, and you can ask them like, what's the research culture like? Do professors allow it? And
off the top of my head, some institutes that do really good quality research, I would say JIPMER does good quality research, AFMC does wonderful research, AIIMS Delhi does wonderful work. I think even the other Delhi colleges, they do good work, like LHMC and all.
Yep. So in Delhi colleges, VMMC is very good at research. So it has well-developed departments, and in VMMC you will also have a lot of freedom as such. So that adds up, and you can have an exponential research output if you are interested in it. And in LHMC, I think again the pressure thing is there. Although the professors are really great, I think there are some funding constraints at LHMC also. So these are the things that you'll have to consider. So
funding constraints in research would always be there, like in whichever institute you choose to pursue research in. That would really depend on finding a good mentor, because your mentor is the one who would get you the funds. Like AIIMS has this intramural grant for undergraduates, in which they provide us 2 lakh grant per year to pursue a project. I don't think any other institute has such a grant. So
I don't think you.
yeah, so if that is not there, it mainly depends on your mentor, like how they are funding your project.
Yep, and I think GMC Chandigarh is also really good at research. Like I think it's anecdotal for me because I've seen a few good papers from there, but I'm not sure. So this is something that you'll have to look up, like what's the research culture over there. And I think uh, one more thing that would be important over here, which is like not very important, but a little bit. So it's something that you might consider while applying to a college. Would be, where is the college based? Like, is it based in a metro city? Is it based in a tier 2 city? Is it based somewhere where it's very difficult to reach? So the thing being, if you are living in a metro city and there are a lot of other colleges in that city, for example Delhi, uh, the benefit here for a USMLE candidate would be that we have a lot of conferences to attend. For example, if there is a conference at AIIMS, we can attend that. If there's a conference at VMC, we can attend that, and a lot of other colleges, right? And that helps in building your CV. And also it's a kind of network sort of thing, because if you have people around you and your college is the one which does not do good research, you can always go to the neighboring college, you can collaborate with someone over there, and you can do research. At AIIMS also we have some projects which are done in collaboration with IIT Delhi, for example.
IITs, then THSTI.
Yep. So that would also be helpful. And also it's like I think it helps in a broader personality development as such, because in USMLE, while you would be sitting in your residency interview, you would be
They assess you as a person rather than just as a set of numbers, your step scores.
Like I have heard outrageous stories of people being of people telling their about their interviews that like the interview people only talked about their hobbies only. So if you are living at a place where you are not
if you ask me, that's not outrageous really, because
because they are actually
they are looking for colleagues with whom they want to work for the next 3 years. So it's fairly good game to ask about their hobbies. Getting to know
exactly. So like, while you can develop a very good personality by living in a college which is completely isolated, living in a metro city provides you with, I think,
more exposure.
Yes, you can like roam around at 3 a.m. at night and you can do stuff over here. So although that's not linearly adding up to USMLE, it's something that remotely might affect even positively or negatively, but that's a factor that you should consider while choosing a college in general as well. Like, what type of person are you? If are you a bookworm who would just want to sit and read a book, then I think you should prefer a college in hills somewhere, because that would be good. Like, you'll have a good scenery over there. For example, AIIMS Rishikesh is such a wonderful college. It has a beautiful campus. But if you are someone who is a party person who would want to go out and visit places, then I think choosing a metro city would be good.
Maybe Goa.
Yep.
And lastly, although we started by saying that the prestige of an institution shouldn't matter at all, I would like to mention that it does matter to some extent. Like the brand value of a college actually matters, but it matters more because of the alumni network. Like AIIMS has a brand value because it has alumni in all the major universities in US almost, and also Europe, but because we are talking about US.
Yep, it's more like suppose if I'm sitting in a residency interview and one of the panelists is an AIIMSonian, so that person would might be a bit more biased towards taking me because I'm from his or her own institution. So they might feel that, okay, this is a person, like, I know where he's coming from. So that's why that's what helps, right? So if you have a college, for example, AIIMS, MAMC, LHMC, these colleges have a brilliant alumni network over in United States. Even KMC has such a wonderful network in United States, right? So these colleges would help you in that sense. Otherwise, for prestige as such, like, a lot of people think that if you are an AIIMSonian, you'll definitely match somewhere. I think that's false. Like, that's not something that you can just say off the top of your head that you'll match somewhere just because you belong to so and so college. That's not how USMLE works. So it's more about your alumni network only, and that is something.
Networking is something that would help you all the way, like through the USMLE process. Like, it helps at every single step, like from getting clinical electives to the match process. Like, at every single steps, your networks matter.
Yep. And as far as researching the alumni network would be, so it's a tough task, like for us also, if you want to search like if we have an alumni at so and so institution, it becomes very difficult. So I think for that, uh, even if you ask a student over there, that won't be helpful because most students are oblivious to this. So you can open the major university websites and you can just open the faculty directory and you can search for keywords like the name of the college, and sometimes these faculty have that college filled in their profile, and that name pops up, so you can get a broad idea as to like what are the people from that college doing right now in United States, like whether there are such people in United States or not. But yep, that's
Yeah.
it. But
Also, like there is this site called Doximity, and Doximity has this feature in their residency navigator, which is like one of their services, where they show the top feeder institutes,
yep.
like which medical colleges are sending most students to such and such residency program, and you can go through those to find out which programs have the most alumni from your medical college.
Yeah. So I think that's it for this video. It's pretty long and I hope this helped you to
Yeah.
select a college. Stay tuned for more videos. Thank you.
Thank you. Bye.